So, welcome to the third webinar. This is the physiology webinar, and this section will be about the physiology part of the Table 7. When you open the main menu now in the Table 7, you can see that there is a new section called the Physiology, a new icon here. When you press on the Physiology button, you will see this dialog. And this is the physiology dialog, in which you have all the 6 sections that are included in the physiology part. The first 2 are about the heart motion. The first is the heart motion in the high resolution original anatomy of the heart of the female Asian body, and the second one is the heart motion of the female full body Asian. The third part is again about the nerve pathways, and in this part you can investigate and visualize and study the nerve pathway that are in the body. Then we have the catheterization section, and in this section you can test, visualize, and also perform some catheterization pathway with different type of procedures. The last 2 sections then are about the physiological pathways, and are both with the female Asiatic full body or the male Asiatic full body. So you can decide to open either the Wiki or Victor and investigate and create new physiological pathways. Let's start with the heart motion. I've decided to open the regional anatomy heart in order to better understand and visualize the heart. So I've already opened this section in order to avoid the time of the loading. Okay. And this is the default visualization when you open the heart motion part. As you can see, you have the visualization with the heart, which is already moving, and then a dialog called ECG dialog that by default it opens on the screen. To open and close this dialog, you can press on this button here below, and if you press on it, the dialog will disappear. If you press again, the dialog will appear again. In the ECG dialog, as you can see, there are different parts. Here on the upper part, there is a graph with an ECG curve with the time and the EP. Then you have a pause and play button, 2 slider bars, and some check boxes here. When you press play or pause, you can see that the heart will stop moving by pressing pause. As you can see, the ECG slider bar that before was unactivated now is activated. So in this case, you can move the slider bar and slightly moving the heart. With the ECG slider bar, the heart will do only one ECG cycle, and you can see exactly how the heart moves and how the heart movement corresponds to the QRS curve. Like this, back and forth. When you press then play, the heart will start beating again automatically. And you can see how the ECG slider bar is disabled, and the heart rate slider bar is again activated. Through the heart rate slider bar, you can increase or decrease the heart rate. You can see that from also the number of BPM here in green. So when I move on the right, the slider bar, the volume of the BPM will increase. And when I move it back to the left, the number of BPM decreases. Under the BPM value, there are 3 checkboxes that I mentioned before. The first one is about the ECG. If I press on this checkbox, I will see the ECG curve will change, because now you can see at the end it will continue automatically. Instead, when you not activate the ECG scroll function, it will start again from the beginning. Another checkbox here is the conduction one that we will see later. Let's focus on the slow motion. If you activate the slow motion function, you will see the heart that is moving more slowly. You can still change the heart rate even if the slow motion function is on. But of course, it will move slower. Also, even if the number of BPM maybe is the same as before. If you then activate only the nerves, you can see what the conduction. This means that when the nerves here has the conduction, they will be colored in yellow. If I disable this function by clicking on the checkbox, you can see that the heart is moving, the nerves are moving, but they are not anymore colored in yellow when the conduction goes through these nerves. Another function that you can create and use with the heart motion is maybe highlighted some structure on the heart and see how they move and how they behave during the heart motion. I did it by creating a preset. Okay. Let's see now the second section, the nerve pathways. I have already opened this section in order to avoid the time for the opening. So this is the default visualization when you enter the nerve pathway section. So you have the full body of the female Asian, and already opened a legend dialog in which you have at first a list of type of nerves. As you can see, on the skin of the body, you can see that there is a map of dermatomes. When you touch on one part of the skin, automatically some part of the dermatomes will be highlighted, and also the nerves that touch and are connected with that part of the skin. In this case, since we are talking, we have touched the skin and we are starting from this part of the body, the nerves that are highlighted are the sensory nerves. In particular, you can see from the legend of here in the dialogue that the nerves colored in orange are the sensory mixed nerves. So you have all the nerves that are the sensory touch and the nerves that are in the sensory pain temperature. If you want to highlight only the sensory touch nerves, you have to select the yellow part on the legend. In this case, only the nerves that are included in this section will be highlighted. If you want to see only the sensory pain temperature nerve, you have to select the red box. And the other type of nerves will be highlighted. In the legend, you can see that you have also another part that is a part in which we have the name of the nerves that are highlighted, the name of the spinal cord tract that are interested in this pathway, and the name of the cortex region. The cortex region is also highlighted here in purple. So if you rotate the body, you can see that a part of the brain will be highlighted in purple, and this is the cortex region interested in the pathway. You can do the same thing by using the slider bar and removing some structure. For example, if you want to start from a muscle and you want to see that particular nerve pathways, you can touch on a muscle, for example, this one of the arm, zoom in, and see the pathway that starts from the muscle and goes to the cortex region. You can see, sorry. Okay. You can see that this time the nerves are colored in blue. This is why if you see on the legend, these nerves are the motor nerve. So the ones that are connected to a particular muscle. In the legend, then you have the name of the muscle that you have highlighted, the name of the nerves, in this case only one, the name of the spinal cord tract interested in the pathway, and the cortex region. Again, the cortex region is highlighted in purple. If you want then to investigate and to see other different type of pathway, maybe starting from some internal organs, you can still remove some structures to this slider bar and select, for example, one of the internal organs. In this case, I'm interested in the urinary bladder, and I touch this organ, and automatically it will be highlighted. In this case, it's slightly different. The nerves are not highlighted by default, but you have to select on the legend if you want to see the sympathetic pathway or the parasympathetic one. In this case, if I want to highlight the sympathetic pathway, I select on the green box, and immediately the nerves that are included in this pathway will be highlighted. If I zoom in next to the organ, I can see how the nerves are interconnected with the organ, the urinary bladder, and how the pathway the pathways are connected with the nerves also in the spinal cord tract. So you have again the name of the structure on the legend, the name of the nerves that are highlighted, and the name of the pathway termination point. That in this case is the brain in the brainstem, and this part is highlighted. Another way to select a pathway is also by starting from a nerve. So if I select, for example, one of the nerve, for example, one of the nerves that are next to the spinal cord, okay, I will have automatically highlighted also all the other nerves that are connected and that are attached with the nerve that I have selected. So the nerve selected will be also annotated with the name of the nerve. And in the legend, you can see all the type of the nerves that are highlighted and the name of these nerves. In particular, from the legend, you can select or deselect the different type of nerves that you want to highlight. So in this case, all the type of nerves are highlighted. So the motor nerve, the sensory nerves, and the sensory plus motor nerves. But if you want to investigate to see only the motor nerves, for example, you can select the blue box And in this case, only this type of nerve will be highlighted, with also all the muscles that are involved in this pathway. So all the muscles that are connected to that type of nerves. If you turn the body, then you can see also all the part of the brain that are connected, that are interested in this pathway. Okay, let's move to the third section. This section is the catheterization one. I've already opened this section, and this is the default view. When you open the catheterization section, differently from the first two, you have to press on this little icon here on the bottom to open the catheterization dialog and to activate the tool. So if you press on the box, you will see that there is an icon with two different columns. The first one is a procedure column, and the other on the right part of the dialog is a path column. If you can choose between 4 different types of procedures, and for each procedure, you can see that under the path column there are different type of pathways. So I can choose between the percutaneous coronary intervention, the coronary angiogram, the ventriculography, and the right heart catheterization. Let's suppose I want to see the percutaneous coronary intervention, and if I want to select the procedure, I can choose between these 4 different type of pathways. Let's suppose then I want to choose the right femoral artery to the right coronary artery. I select the pathways and I press OK. Automatically, the visualization of the body also changes, and also the dialogue. In the dialogue here, you have 2 different type of column. The first one is a column with all the steps of the pathway. And in the right part of the dialogue, you have then a box with some physiological values and 2 different slider bars, one for the catheter length and one for the balloon inflation. As you can see at the beginning, these slider bars are not activated. This means that during the pathway, you will have the possibility during some steps to use these slider bars. So by touching the first step, you can start the pathway. If you want to change the visualization to make them see better, you can, for example, zoom out and change the type of orientation of the body. In this case, the needle that is being inserted is more visible. So let's go to the second step, remove the syringe. Insert the guide wire. Remove the insertion needle. Insert the introducer set. Remove the guide wire and the dilator. And then insert and place the guiding catheter. As you can see, when I press this step, automatically the visualization changes. This is because now we can use the slider bars, the catheter length slider bar, to insert the catheter until the point that we would like to touch, to reach. So through the slider bar, I move it and I perform the insert and place guiding catheter step. When I stop in a point of this slider bar, I can see that also the catheter stops in this particular point of the body. So it's up to me to decide where is the most suitable point to place the catheter. Next to this slider bar, you can see also that there is a value in millimeters, and it is the length of the catheter. I can go through the next step then, insert and place the balloon catheter. And again, the catheter length slider bar is activated. This is because I have to insert another catheter. Once I have reached the point that I want to reach on the body, I can go to the next step. So inflate the balloon. The balloon is here because I've just inserted the catheter balloon. So in this point, you can see probably by moving the second slider bar, a balloon inflating. I can zoom in to see it better. So by moving the balloon inflation slider bar, I can change the level of inflation of my balloon here. Once I'm done with this step, I go on and I have to remove the balloon catheter, again through this slider bar. Place the stent delivery catheter. So I place another one. And inflate the stent delivery balloon. Again, the other slider bar will be activated. And if I look in the same spot here, I can see how the stent will be inflated. As you can see, this catheterization pathway tries to recreate in the most similar way as possible what is really happening during a real catheterization. One big difference is that the heart here is not beating. While you perform a catheterization, the heart is beating. The heart of the patient is really beating. That's why we are in this section. There is also another tool introduced, that is the heart motion. If you press on the other icon next to the catheterization icon, you can open the ECG dialog that you have seen before in the heart motion section. This is because if we want to recreate as in the most similar way the catheterization, you can press play and automatically the heart will start beating. In this case, you can see how a catheterization a procedure is performed while the heart of the patient is moving. Again, you have all the, you can press play or pause, and you can put the slow motion and change the heart rate. So all the features and the tools that we have seen for the first section are, you can find it also here. So you can change, you can decide to operate maybe on a patient with the heart that is moving really fast, with that is tachycardic or bradycardic. So we can go on with the procedure and go to one of the last steps. So remove the stent delivery catheter, always with the slider bar. And then removing the guiding catheter. And now this was the last step, so the procedure has finished. If you want to change the type of pathway, or if you want to change the type of procedure, you can press on the catheterization dialog the change button. In this case, you can go back to the first dialogue and change the procedure or the pathway. If you close all the dialogue, you will go back to the normal visualization. Let's see now the fourth section, so the pathway. As I told you before, for the last section, you can choose between the female Asian full body or the male Asian full body. I've already opened the female Asian full body section. So this is the default visualization when you open this section, so the pathway section. And if you want to activate and to start exploring the pathways, you have to press on this icon here on the bottom. Once you have pressed on the icon, there is this type of dialogue that appears. This is the pathways dialogue. Here you have a list of pathways already made by Anatomage. So you can scroll through different types of pathways, physiological. These type of pathways that are pre-made cannot be modified. So if you want to create a new pathway or to modify one of them, you have to press on new or to open one of them and modify it. You cannot, you also have to change the name of the pathway because you cannot edit this one. You can see that next to the pathway pre-made, so the one that are not editable, you have a purple arrow. This arrow means that you cannot modify them. And you can see that the last one, that is a test pathway that I've created and that was created by a user, have a normal arrow, so a white one. This means that this can be modified and also deleted. Let's open, for example, the insulin pathway. I press on the arrow and automatically the pathways will be loaded. As you can see, the visualization of the body has been changed. And there is a dialogue that has been opened. In this dialogue, this is the pathway dialogue. So you have on the left a list of steps of the pathway, and on the right, different type of tools and also the target structure for each step. So as you can see, the first one is the injection stomach to heart. In this case, you can see that there is one target structure that is the stomach. The other step is the heart. The other target structure is the pericardium, and then the heart to liver, muscle, brain. That is the third step. As you can see, then in the first part of the dialogue, you have also a slider bar to go through the different part of the pathway, a play button to start the pathway, and also list of different type of speed, so slow, medium, or fast. For each step, you can select the type of organ that you want to highlight and to target, the title of the steps, and also the type of targeting of the stomach. So if you want, that is can be an organ to heart type of highlighting, or heart to organ are pre-made type of target organs or target organs. Let's try to see the pathway. So let's play. As you can see, the stomach that is the target structure is highlighted. And now, since it's an organ to heart type of connection, the the visualization is going through the heart, and all the pathway that goes through from the stomach to the heart is being highlighted. Now we are in the second step, and there is the pericardium. In the third step, then all this type of structure that then will be highlighted. The type of connection is heart to organ. So as you can see, we will go through the pathway that brings the heart, from the heart to this type of organs listed here. For each step, you have also you can, as I said, modify the type of structure, the target structure. So, for example, if I want to add other structure, I press on Add. I select different type of structure, for example, the pericardium, and I will see that the pericardium will be listed under the stomach. Once I finish the selection, I press on Finish button, and in this case, I have modified the list. Another type of modification that I can do is to change the animation effect. In this case, the stomach has a fill animation effect. If I change it to flow or diffuse, I can see that the type of movement that to highlight the stomach will be different. This is the flow animation effect or the diffuse one. I can also decide to change the animation speed. For example, I can put it fast. And animation color. So if you want to highlight a particular structure, for example, in blue, I can change the color. Let's see also what the type of connection, the different type of connection is. In this case, the pericardium is highlighted with the type target organs. If I change it in organ to heart, for example, I can see that the pericardium will highlight it first, and then also all these steps and the pathway that brings to the heart. Or I, for example, change the type of connection in heart to organ. So if I press play, I will see at first the heart highlighted, and then the pathway that brings to the stomach. Under the animation color icon, you can see that there are also different type of button. The first one is New Stage. In this case, you can use this button to create a new stage, so a new step of the pathway. For example, let's suppose you want to add a different type of structure to this pathway. You can, for example, activate some other organs and adding them as target structures. You can add it to the pathway. Since now you have modified the visualization, you can also press on Set View in order to keep this type of visualization, so this type of view in the pathway. You can also change the name of the stage, like for example test stage. So in this case, when you press play then on the pathway, you will see the visualization that has changed. So you have saved this type of visualization and also the type of organs that will be highlighted. You can then decide to delete this stage and remove it from the pathway. Let's suppose to modify what are the characteristics of the pathway. For example, let's put flow, or let's change the, let's add some structure. If I close this pathway, automatically the table will ask me if I want to save the current pathway. If I press yes, then it will ask me to introduce, to enter a new name for the pathway. If I keep the name insulin as it was before, automatically the table will give me an error message saying that I cannot overwrite the Anatomage pre-made pathway. So as I told you before, you cannot modify the one that I already made. So in this case, I have to modify the name of the pathway and insert, for example, insulin 1. Then if you go to the main menu, in the list of the pathway, you will see that there will be also your new pathway already made and modified. This pathway can be also deleted from the list.